Management of diarrhea, nursing care. Prepared by Mr. Artembo. Aims: to replace lost fluids, to prevent the spread of infection, to prevent complications. Clients who are admitted to the hospital with diarrhea should be isolated until the cause of diarrhea is determined. E.g., patients with cholera are nursed in cholera centers to prevent the spread of infection. In dysentery, patients' isolation and proper disposal of stool by flushing or disinfecting before disposal should be observed. Barrier nursing techniques should be observed, for example hand washing, and wearing protective clothing such as gowns, gloves and face masks. Recommended solutions for disinfection such as Jik or Savlon should be made available. Should have running water readily available. Observations. Monitor fluid intake and output accurately in order to maintain hydration and prevent overhydration. Monitor vital signs, temperature, pulse, respirations and blood pressure 4-hourly. Monitor the type of stool, e.g. whether bloody or not, frequency, consistency and amount. Medication: give medications and fluids as prescribed and monitor the effects. Encourage the patient to bath daily to remove dirt and promote comfort. Prevent skin breakdown by ensuring that it remains dry all the time, especially the buttocks, and wash the perineum if possible after each stool and apply protective ointment if available. Linen should be changed and decontaminated regularly. Oral care to prevent mouth infections as well as moistening the mouth as the patient may be dehydrated. Nail care is also important as nails can harbor microorganisms which cause diarrhea. When food intake is tolerated, recommend a bland diet of semi-solid and solid foods. The patient should avoid caffeine, carbonated beverages, and very hot and very cold foods because they stimulate intestinal motility. It may be necessary to restrict milk products, fat foods, vegetables etc. for several days as these may worsen diarrhea. Health education. Hand washing must be encouraged before touching food and after using the toilet. Proper cooking of food. Encourage the use of toilets and pit latrines all the time. Avoid eating unwarmed leftover foods. Treat drinking water by boiling or using chlorine. Health personnel should practice or observe scrupulous hand-washing procedures after handling bedpans and before caring for the sick. Particular attention is given to the washing of hands after defecation and before handling food.